Assalamu alaikum again. Thank you for having me today. It's my pleasure to be here with you to this honorable attendance to incite ortho-keratology for myopia control, mechanism, benefits, and professional awareness. As we know, myopia is a growing vision problem. As we see in the diagram, in the year 2000, the prevalence of myopia was 23%, and nowadays the prevalence is 34% of the world, and the World Health Organization expected that by year 2050, the prevalence will be 50% of the world. Now we'll ask, what is Ortho-K? Simply, Ortho-K is non-surgical method. It's non-surgical method used to correct vision by reshaping the cornea. It's RGB contact lens, designed especially to control myopia. It's safe, non-invasive, well-tolerated, temporary, and reversible. The Ortho-K is overnight wear. It's the patient wear the lens during the night when he got sleep. The lens applying mild control pressure on the corneal surface. It's flatter the center and steeper the edges, as we see in video, how the lens presses the cornea and flatter center and make hyperopic peripheral. In the morning, the patient removes the lens and he will continue his day with clear vision without any need for glasses or contact lenses. As we see here, original corneal surface without Ortho-K lenses, and here with Ortho-K at daytime after removing the lens. Ortho-K also controls the axial length for the patient. In newborn children, the axial length is about 16 to 18 millimeter, and it decreases with the age. Until 18, it will be 24 millimeter. If there is 1 millimeter change in the axial length from his age, it will be about 2.5 diameter. Now, if the axial length is 25 millimeter, it will produce for us minus 2.5 diopter myopic, and if there is 23 millimeter axial length, it will produce plus 2.5 hyperopic. The Ortho-K also measure also control the corneal curvature. Normal corneal curvature for adult person is 7.7 to 7.8 average. Every 1 millimeter change is about 6 diopter. In this presentation, we aim to highlight the benefits of Ortho-K in myopia control, to encourage the optometrists to introduce Ortho-K in their clinical practice, and to increase the awareness about myopia and myopia control. These two case reports presented here demonstrate the potential of modern ortho-keratology and management of myopia. We'll start with the cases. Case number 1, we have female, 12 years old. She has myopic stigmatism. She was wearing glasses. We follow up with her 2 years. Her father is myopic. When we follow up with her, we see a high progression of myopia, and we explained for her parents about Ortho-K and glasses and their role of controlling myopia. As we see here, all the glasses, OD minus 1.50, minus 1 cylinder, OS minus 1.75, minus 1 cylinder. Due to parents' choice, we started with Ortho-K. We do pre-fitting evaluation performed through corneal topography and ocular health assessment to ensure suitability and establish a baseline. This is the device we use to measure the axial length, this myopia master from Oculus. This device also measures keratometry, barometry, and refraction. We use a Snellen chart to measure the visual acuity. In every Ortho-K case, we should have a baseline to make comparison between before and after, and to make sure that Ortho-K is worked well. This is the baseline for this patient: minus 1.50 cylinder, minus 2.25, minus 1.25 cylinder. Visual acuity 6.6 both eyes. The axial length was 23.78 and 23.38. Based on this baseline, refraction and axial length corneal topography, we ordered the lens. This is the lens specification, 8.5, the base curve, optic zone diameter 6 mm, and total diameter 10.5, and the power is plus 50, plus 0.20. During the fitting, we make sure that patient and parents educate about proper lens insertion, removal techniques, cleaning, disinfection procedure, and providing for safe storage of practice. And to rule out if any warning signs appears, like redness, blurring, or pain. If there's any signs appear, stop using the lens immediately and visit the clinic. We also give him a schedule for follow-ups to do assessment from 1 day until 1 year. The assessment done with and without the glasses to ensure the corneal surface scars or there is no corneal surface scar or opacities, to confirm the corneal surface remain clear, and to rule out of any signs of inflammation. Measurements also taken. Also, if you advise, as we mentioned, watch for warning signs, maintain proper hygiene, when cleaning the lens properly when storing and using, wash his hand well before handling the lens. We advise him also to go outside daily and look at long distance for 1 to 2 meters, 2 hours. Limit screen time, reduce the number of hours spent in electronic devices to maintain proper viewing distance. And if the patient or student are studying well, we advise him to follow the rule every 20 minutes, look at something 20 feet away for 20 seconds to reduce the eye strain. Now we'll talk about the results. This is the result. This is the data we measure from myopia control device. This is the data before using Ortho-K. As we see here, 23.78 axial length, 23.68 millimeter at the OS, spherical equivalent minus 2.75 both eyes, mean keratometric radius 7.60, 7.50. But the brain holding vision situ system gave us calculation that the patient will be at age 22 years, minus 5 diopter. By the way, based on these parameters, we suggested that parents and patient consider starting with Ortho-K, as it our duty as optometrist. When measurement indicate that by year 22 it will be minus 5 diopter, it's essential to prevent progression and minimize the risk of developing refraction error and related disease. Our goal is to protect patient vision. This is the measurement after 1 year. We stabilize the axial length when using Ortho-K, 23.71, 23.73 millimeter, and the spherical equivalent much better, minus 0.25. The mean keratometric radius is more flatter, 8.09, 8.12 millimeter, and also the brain holding vision situ system gave us calculation that by age 22 years it will be near emmetropic. The axial length was changed by 0.08 in OD and 0.05 in OS. Also, the corneal curvature is changed by 0.50 in OD and 0.62 in OS. This corneal topography for patient, as we see here, corneal astigmatism with the rule. There's before using ortho-keratology, normal topography, and here is after 1 year of using Ortho-K, flat center and hyperopic edges. This is the 3D topography. As we mentioned, corneal astigmatism with the rule, here flatter center, after 1 year of Ortho-K, peripheral hyperopic. Here's the chart of follow-ups. We saw change in K readings. The patient started 7.5 average, and in 1 month there was rapid change. After that, stabilized or slightly change in K readings. The same thing at spherical equivalent. The patient start minus 2.75. The first 1 month there was rapid change. She is near 0.75, and now she is near emmetropic, 0.25. In this case, we reached our purpose to control myopia by using Ortho-K, and Ortho-K lens worked very well with this case. Now we start with case number 2. Female, 11 years old. She is myopic, wearing glasses. OU was -2 diopter. We did observation, revealed raised about 1.5 along 1 year. We advised parents and patient to use Ortho-K lens, explaining its role, controlling myopia progression. All examinations were done as same as the first case. The new prescription was OD -2.75, OS -2.50. Due to parents' choice, we started with Ortho-K. This is the baseline for the second case. The difference between the first case and second case is K reading and axial length. In this case, the patient started with us before 2 years. In that time, we didn't have the measurement myopia master. And we ordered the lens due to the K readings and the refraction. 8.14 K reading in both eyes. This is the lens specification for the new case. And after that, we measure, after using the Ortho-K lens after 2 years, we measuring the axial length is 22.65 millimeter, 22.85 millimeter in OS. The spherical equivalent is -0.25, -0.50. And the mean keratometrics also changed, more flatter, 8.68, 8.57. ما كان في عندك زلك. And the brain holding vision statue system gave us the calculation. It will be at 22 years near emmetropic or -0.50. The corneal curvature changed by 0.54 in OD and 0.45 in OS. This corneal curvature for the patient. She has myopia, no astigmatism here after using Ortho-K in 1 year, flat center and hyperopic peripheral. This corneal 3D. In this case, the same thing. The K reading, she started with 8.15, and in the first 1 month, the change was a rapid change, and after that stabilized or slightly change in OD. The same thing, spherical equivalent, -2.5, in 1 month rapid change to -50, and after that she stabilized at -0.25. To conclusion, ortho-keratology is a safe, reversible. Its primary goal to enhance visual performance and improve patient quality of life by reducing or eliminating the need for glasses or contact lens during the day. Although initial lens wear may cause some discomfort, most patients experience significant improvement in comfort within the first week when proper lens care protocols are followed and regular follow-up assessments are maintained. Ortho-K is a safe and effective option for eligible patients. We recommend that every optometrist are encouraged to integrate ortho-keratology into clinical practice as an effective myopia control strategy, especially for children and adolescents. The second thing, raising awareness among patients and parents about the benefits of Ortho-K and the risk of progressive myopia, and also to promote community awareness campaign to educate the public about the risk of progressive myopia and the role of ortho-keratology as a safe, effective intervention, especially for children. The last thing, early screening and community engagement are as recommended to promote timely intervention and prevent high myopia. Thank you for listening. If there is any question, you're welcome.